programme. Okay, and the programme is designed for recent graduates with a degree in public health or an equivalent relevant degree level qualification. So that is, health and social sciences, that sort of thing would be applicable. And what it does, it gives you the opportunity to use your learning over the sort of in a very dynamic health public health department. Just making sure that I'm going to stop the transcription. I don't know whether you can see it on your screen, or whether it's just I can see it on mine. Okay, but it's putting me off. So yes, so it's it gives you the opportunity to use your learning that you've learnt in your degree and put it to use. It is a quite unique opportunity as a graduate opportunity, and because working in public health, you may or may not know, but it's very much a learning environment, very much a development and progression environment. So actually, if you've not heard of the public health skills and knowledge framework, it's worth having a little look at that. The UK PHR skills and knowledge framework. This is what we strive towards, and I'll explain a little bit more about that later on. So the graduate will be working to either director or an assistant director on specific projects and responsibilities as part of the 12-month placement. Those will depend on the business needs and the sort of the priorities that we've got within the division. Okay, so it's quite a tailored program. We have a skills and knowledge audit, which is linked to the UK PHR standards that I've just mentioned. We have some onboarding sessions, so we're very much about induction, whether it's corporate or whether it's public health induction, and making sure that everybody's understands the team and goes into a little bit more detail based on what we do than I've just done. And then you would be introduced to an educational supervisor, which would be an assistant director. So you're working directly for an assistant director, which is a great opportunity in itself. They will have a work plan, and they will you'll be sort of supported throughout that work plan by your sort of supervisor, depending on which assistant director that is. And you were given specific projects. So it's very project based. In fact, the whole of public health is very project based. So it's really important that you could put, you put your project management hat on, if you like. It's a 12-month fixed term contract. And yeah, you'll be assigned special projects, given development support and supporting the wider division. Just in terms of some of the questions that I've been asked, it is a 12-month fixed term contract. It doesn't automatically move into another job. It doesn't extend beyond the 12 months. It is a 12-month fixed term contract. You can then obviously apply for jobs within the division. In terms of visa requirements, I don't think it comes up any other time. So in terms of visa requirements, if you have a graduate visa, a student visa, or a graduate visa with time left on it, that's absolutely fine. But we don't sponsor skilled worker visas because it's not a hard to fill role. But if you have time left on your student or you have a graduate visa, then that's absolutely fine. So some of the other support that we offer is around pastoral support. So that would be done through myself. So you might work to your AD or within a team within public health, but there's other things that you might want to. I will check in with you, make sure it's okay. I do graduate sessions around sort of employability or working in a political environment and those sort of things. So I do sessions most months for the graduates to sort of get together and learn, making sure that you're progressing, developing outside of just doing the project work as well. We have some really good peer support groups. The graduates tend to make a bit of a peer support group of their own, to be fair. So you've always got people there to support you, and we have some really good early careers networks as well within the council. Okay, so in terms of career progression, there's various grades. We are actually going through a grading restructure, but that said, it's fine to have this information here. So the sort of entry level roles, which the graduate role is an entry level role, as is a support officer. Then you're going to potentially move up to a public health officer, which would be the next grade up, and then a senior officer. If you want to become a consultant or assistant director, or if you have visions of becoming a director of public health anywhere within the country at some point, then you need to get onto the specialist register, the UK PHR or the Faculty of Public Health specialist register. So, but we support through the practitioner, through senior practitioner, through becoming a specialist as part of the development work that we do within public health. So it doesn't mean that you can't become a service lead, for example, but if you do want to move up to that next level as a consultant, a public health consultant or assistant director, then you would have to become on the specialist register. It's not an easy pathway. Becoming a practitioner is well doable for everybody. It's that continuous learning and continuous development that's really important. But it's absolutely able to. You're absolutely able to do that, and we're committed to progressing people through the organisation as well. Okay, as a graduate, as part of the development opportunities, we do skills and knowledge audits. So we do those every year based on the UK PHR 36 standards over the 8 areas. And it's self assessed, but you take that to your manager and you look at where your gaps are, and then we help to develop you in a way that fills those gaps, and we keep on top of that. So we have developmental projects that you might want to do in addition to your work in order to pick up those additional skills. So this is something that we do every year, and as a department, I will then look at maybe some of the things that we're lacking as a department, and you would take that to your manager as an individual as well. As I mentioned earlier, if you want to become a practitioner, we have support programs which we sort of then meet regularly and look at this criteria and how we're meeting the criteria, or how you can meet the criteria and what else you can do to develop that particular area from the sort of the UK PHR standards. Mentoring coaching is quite big within the council, not just public health, but within the council itself. We have a project development tracker. So again, as I mentioned, projects that you could do which would help develop in particular areas. We have lunch and learns. Hopefully some of you already signed up to follow us in terms of our lunch and learn program, but obviously you could, we do those 2 or 3 times a month on various subjects. Most of the department do some sort of lunch and learns. We have a sort of a learning system called iLearn, and on that there are hundreds literally of different courses, whether it's sort of self-paced, whether it's sort of videos, whether it's attending a course, what have you, that you can sign up to, which is all available to the graduate. We have peer support programs, and then we have the access to Future NHS website, which has lots of resources on there from a learning perspective. Okay, so that's something about the graduate role. I just want to talk about how you apply, some of the things, the do's and the don'ts, to make sure that your application is as good as it can be. I'm just conscious of the time. I'm whipping through as quickly as I can. Hopefully I can get to the end in the time that we've got. So a couple of things to myth bust. A lot of people think, oh, the supporting statement can only be a couple of pages. Actually, your supporting statement, you've got up to 1,500 words. Don't go over that, because that's the limit. And it should evidence how you meet the criteria. Okay, so making sure that you use the words that you've got available and you evidence how you meet the criteria. The second myth is often that you shouldn't take notes into an interview. You should be able to think quickly on the spot. No, please do take notes into an interview. It shows how prepared you are. It shows how you've thought about what questions you're likely to get answered, and it gives you a little bit of calmness in terms of your ability to answer those questions. So please feel free to bring any paper, notes into an interview. The other myth is people say you can't use personal examples or study examples when you're coming up with examples to answer the questions. And no, you absolutely can. This is a graduate role. You are not expected to have worked in public health for 10 years. It doesn't work. That's not the point. The point is that you have skills and knowledge, and you're able to evidence them. So even if you haven't done something in public health, you've probably done something in a different walk of life. So you can use examples related to your studies, and you can use personal examples if they show that you have the skills and knowledge, transferable skills, for example, in a particular area. Okay. So you will notice from the job advert that we have a job description and a person specification. Okay, so job description is as it sounds. It's the tasks required to do the job, the role, the context, the responsibilities, overview of the service, grade, location, that sort of thing. So in terms of grade, well, no, in terms of location, it does say hybrid. You're expected to work in the office probably 1, maybe 2 days a week, or you might be out on site. So we do a lot of citizen engagement. So it might be that you have to go out on site at some point. But Tuesdays in the office at the moment is what we do. So that's the expectation, would be that you'd be in the office in Birmingham on a Tuesday. So should be no surprise that Birmingham City Council has its offices in Birmingham. So that's the job description. The person specification is all about the experience and skills and abilities, values, behaviours that you need for the job. So the person specification is really the one to focus on. That's the one that you need to show how you meet the criteria that is has been set for this particular role. Okay. You will look at them and you'll notice, hopefully you'll have looked at these and it will make sense, this particular slide, but you'll have noticed how the things are set up. So if it says AF, that means application form. I think there's a slide a little bit later on which talks about the mode of assessment, but if it's got AF next to it, you need to tell us, you need to demonstrate some evidence of how you meet that criteria. If it's just got an I next to it, you don't need to do that at this stage. That is for if you're successful in getting an interview, you will be asked about things that have an I next to them at interview. So as you're going through your personal statement, focus on the things that are say AF next to them effectively. Okay, so you do need to write a supporting statement. You've got 1,500 words, don't do any more. And making sure that you meet the criteria. So this is your opportunity to show us how you meet the criteria. Examples of things that you've done, experiences that you have, whether it's through your academic studies, and anything that says application forms of the AF there is something that you need to include. Set it out as clearly as possible, if you can, so that nobody's going to have to search through all of your 1,500 words to see whether you happen to meet a particular criteria. Okay, so shortlisting will be done based on how you meet those criteria. Okay, so it's assessed against the criteria. We'll not score sections that don't clearly align to criteria. So if you do tell us something that's on the I for interview, it won't be scored at this stage. Okay, and I'm afraid whether we like it or not, it's all about the numbers. So if you don't you don't score a point for a particular bullet point, that's you don't score. That's that. Okay, so it's really important that you look at the job specification and you tell us something about everything. We ask for a minimum of 2 examples. Sometimes, obviously, you might struggle with the word count. So again, don't go over the 1,500 words, but it's really important that you give us examples. Okay, so if it's just hearsay, that you say you're good at something, but there's no evidence to back that up and support it, then it won't score you any points effectively. Okay, use things like the STAR technique. I think I'll talk about that a little bit later. Use things like the STAR technique, and remember, if you don't say it, we're not going to assume it. So just because you've worked in a particular environment, we're not going to assume that you can do a particular thing. You need to tell us everything, okay? Whether it's as part of your supporting statement or your interview as well. Okay, so it's about giving us more than just I successfully implemented a project. If you say I successfully implemented a project, that doesn't tell us how good you are at doing that. So you need to add the so what, you need to give us a bit more information, you need to tell us the why. Why did it make a difference? Give us a little bit more. So be specific, okay? And there's just a couple of examples there, but it's all about being specific and giving us that evidence. Okay, so your application, what happens to it is we put together a panel, and the same panel do all the shortlisting and all the interviews and make the decisions. In this particular case, it will be assistant directors as part of that, because the roles will be working to assistant directors. Each panel member does individual shortlisting, so they will look at all of the supporting statements and CVs that you send in, and they will independently shortlist. Then they will get together and ensure that there's agreement in terms of the numbers. So one might say you score a 3, the other one might say you score a 0 or a 1, and then there needs to be some sort of moderation, which says, oh, actually, I found that evidence. Oh, actually, I didn't read it as that. Yeah, I get it now. And then there's moderation. The same panel will facilitate the interview process, so it's a level playing field throughout. So the mode of assessment I have mentioned before, but it says on the person specification, you should recognise this. If you've looked at it, it says mode of assessment MOA. So if it's AF, it's for application form. You need to get something in there on that. If it's interview, I for interview, P for presentation, that sort of thing. You don't need to worry about that on your application, but you definitely need to do anything that says AF. We score it based on those 4 things. You either have very strong evidence and some robust examples, you have some okay examples, some good examples, you have poor, nothing much that is an example, or there's nothing offered to demonstrate the capability and the criteria. So 0, 1, 2, 3. Those are the scores. So yeah, just make sure that whatever you put in is robust and is an example of something that you've done. Okay, when you're filling in the application, so WM Jobs is the only place that you can apply. I know I've had quite a few emails through the public health, the workforce development email box. I have replied to all of the people saying, I'm not going to accept applications through there. You have to apply through WM Jobs. So it's a training role, so tons of experience is not necessary, but be aware that the process is relatively competitive, so bring your A game effectively. Make sure all the boxes are completed. Make sure that you're eligible to apply, because if you haven't got a right to work, for example, then you're not going to get past the first over the first hurdle, unfortunately. Fully complete the personal statement and CV using your 1,500 words, no more. Be really guided by the personal specification in terms of the skills and your evidence. Take your time. This is not something that should be done within 20 minutes. You've got to really think it through. And I will say this now, I'm not sure how this is going to work, but please submit your application as soon as you can. Be aware that there is highly likely that we might close the applications early due to the high volume. I am very aware that obviously we have this session now, and I'm assuming that a lot of you are interested in the role. So get onto it now. Get onto it now, because there is a limit to how many applications we can receive, so we may have to close it early. Some of the things that are a bit of a no-no is to skip boxes or embellish any answers. If you can't back it up at interview, don't put it in. Don't be generic, be specific. in terms of evidence. Don't attach things like certificates. You've not been asked to do that. Either give us the information in your supporting statement or write stuff on your CV. Those are the two attachments, and that is it. Your personal statement is not your CV. It's about your relevant experiences that apply to this particular job, but obviously you do attach your CV anyway. So that next one, don't put it in if you can't back it up at interview. Your job history won't be marked at this stage in terms of shortlisting. So from a CV perspective, sort of, that's you just need to get it on there effectively, but it's your supporting statement that's going to make the big difference. Just conscious of time. If you get through the stage to an interview, it'll be a competency-based interview, and again, it's all about your capability and specific examples. So again, really being specific. All of our interviews within the council are competency-based. So some things in terms of competencies are things like time management, responsibility, communication, problem solving. So you will be asked for examples to show you have the ability to do those things as part of your interview. STAR, if you've never heard of STAR, here it is, just quickly. If you think about this for your supporting statement, and if you think about this for your interview, it's very, very important. So situation, task, action, result, and then potentially if you want to put a reflection on the end, that's also fine. But the situation, task, action, and result are the most important things. So what's the context, what you did, and what was the outcome? Those are the things that we're trying to get across. In terms of the council, we do have a really good retention rate in terms of our graduates. The 3 graduates from last year have all secured permanent roles or fixed term roles within the council. So and previous graduates have all moved through, and some are even in service lead positions now. So it's a good place to be. It's a good organisation to work for in this particular sort of area, line of work for sure. This is how you apply. You apply through wmjobs.co.uk. Put in the public sector graduate role. It will come up, and that's the link to click. As I say, don't send it an email, because I will just send it back saying you need to go via this this link. Hopefully you've all seen that before. And then just some resources there. So we're pretty much at the end. So whistle stop tour, I appreciate that was very, very quick. And with sort of just a couple of minutes if anybody has got any questions. But yeah, if you want to have a look at some of our information around public health updates, some of our information around sort of events that we have, and resources, and some of the projects that we've got on the go, then there's the QR code for that. Hopefully that will work for you. Okay, so let's just, okay, so I'm going to click onto the next one just because that's that. So we'll try and take some questions if possible. So when do applications open? The applications are already open. In fact, it's due to close on Monday, but I'm really making a bit of a caveat there, saying really I can't stress enough the fact that it might be that we close it early because of the number of applications that we have. So be aware of that. Right, just before we talk about any more questions, because there might be sort of some individuals that want to talk, I'm going to stop the recording if that's okay with everybody. Just do that.